Prompting. A prompt is simply doing something that improves the child's chance of success. Kind of like a reminder of what you want the person to do. These can be physical. That's when we guide the child or individual through it. These can be gestural, revealing the correct answer non-verbally without touching. Think pointing at the item or something like that. Or even nodding your head towards it. Modeling. This is demonstrating the correct response. Or verbally, telling them what to do. There's also visual prompts, which is like a picture reminder. So if you think about, you see like a door maybe, and it's one of the, like a unique door at a grocery store, and there's a little picture on how to open it. That's a visual prompt. But if someone says, hey, make sure to turn the knob the other way, that would be a verbal prompt. Or if the guy came over and showed you how to do it, it'd be a modeling prompt. Or if you pointed at the thing, what you were supposed to do, it'd be gestural. Or if he grabbed your hand, which would be kind of awkward, right? And actually moved your hand through the action, that would be a physical prompt. So again, there are several types of prompts. Physical, which is guiding the child through it, or individual through it. Gestural, revealing the correct answer non-verbally without touching. Modeling, demonstrating the correct response. Verbally, telling them what to do. And visual, a picture reminder. There's also another one I want to add, which is textual. Textual means you're writing out an instruction. It's a little like a visual prompt, but instead it's words. So I might write out something like, turn knob this way, in that example about a door. Turn knob to the left, for example, would be a textual prompt. So, if we are doing prompting, we also want to be cognizant and aware of prompt fading. Fading is a systematic reduction of intensity of prompts. How to do it. We start with the full physical prompt. We reduce the level of prompts as you go, and you give higher levels of reinforcement for independent responses and lower levels for prompted responses. Remember, that's kind of like the S in DISC, so the size of the reinforcement. So, if we think about a prompting hierarchy, we want to start with the full physical prompt, which is also the most intrusive in most things. But if the person knows how to do it already, or kind of needs just a little bit of help, we can start with a partial physical prompt. Or if they just need a gestural, we would start with gestural and move on down from there. Basically, we want to make sure the person can actually do it without meaning too much failure. So we're going to prompt them, we're going to help them, but we're going to do it in the least intrusive way possible and then work from there. So once they know how to regularly do it with full physical, then we'll move on to partial physical. Okay, once they already know how to do it partial physical, we'll move systematically to gestural and so forth and so forth. We don't want to fade too fast, right? Because otherwise they may not gain the skill. But if we fade too slow, they could become prompt dependent. This is one of those things that needs lots of experience doing, and you're going to need to meet the patient to see where you're at with it. But again, this is stuff that should also be communicated at team meetings, what types of prompts we're using, and where that individual is. It's always good to also have a prompting partner, but if you don't have one, try to prompt immediately after giving the SD and model the action, which would also be known as a modeling prompt. So, how do we keep track of all this? Well, programs include data collection and the errorless learning sheets. These are more learning arts specific, but it'll work in most places anyway. Always write the program name and goal code in the program box. Write the target in the target box and the SD in the SD box. Remember, the SD is the instruction. Now we're going to go over what are phases of errorless learning. MT0, MT3, and RR5. MT0 stands for mass trial, the 0 being 0 seconds between you giving the instruction and prompting. MT3 is mass trial, 3 seconds between giving the instruction and prompting. And RR5, which is random rotation, in 5 seconds. Again, this will make much more sense when you're actually working out in the field. There are 2 different types of boxes for the 2 types of trial. The plus, P, and CP is your target trial, and D stands for distractors. Any items that we're going to use that's not the target item. Training trials are scored as either correct, prompted, or a CP, a correction procedure. CP, correction procedure. Distractor trials. This number indicates how many distractors were given between the trials. And again, a distractor is anything but the target item. Mass trial, 0 seconds. You prompt immediately for the first 4 trials, and then on the 5th trial, this is the test trial, you will wait 7 seconds for the 5th trial. The first time you run a new target, write an I on your data sheet to show that it was introduced. You will prompt immediately for the first 4 trials, and then wait 7 seconds for the 5th trial. The criteria for progression. This is how we know to move on. MT0. The first 4 trials will always be prompted. The last trial must be independent or a plus. So they had to beat the 7-second prompt, remember? You had 7 seconds to wait. If they did the behavior, the response in that 7 seconds, it's a plus. There's what it should look like for criteria for progression. Remember, reinforcement is anything that keeps that child engaged and increases the future likelihood of the behavior. Now, let's talk about mass trial 3 seconds. This way, we will wait 3 seconds between giving the instruction and the prompt. How do we know if we can move on? 80% of the trials are independent, or 4 out of 5. If this is not met, keep running the target as MT3. Random rotation 5 seconds. Wait 5 seconds before prompting, and this is the first and only place we use distractors. A distractor provides a cognitive shift away from the target. They basically have to think about something else, which means that if they can do it with distractors, probably means they're fluent with the target items. It's a good test to make sure they actually know what we're teaching them. A distractor is assumed to be mastered. These are qualities of distractors, the quality of distractors. A distractor is assumed to be mastered or something the person already knows how to do, can be delivered in any order, give up to about 7 seconds for them to answer. If the person is correct, reinforce and move on. If they're not correct, if they're incorrect, just demonstrate the skill once and move on, kind of give them a quick reminder. And if they miss the distractor, write it down in the space below, and in the space below on the data sheet, if you feel like it's something they need to work on again. Again, it's really difficult not being in front of a patient right now to tell you this, but as a general rule, if you feel like it's something they need help on or something they may not know, make sure to write the missed distractors down. Remember, distractors should get moderate to low reinforcement compared to the targets. Why do you think that is? Well, because they already know it. They've already mastered it in the past. It's something that's already part of their repertoire. You don't need to be reinforcing them for stuff they already know how to do, or at least not reinforcing heavily. Indicate how many distractors you deliver between training trials with the number in the distractor box. So if you gave 3 distractors, put number 3, 2 distractors to number 2, and so forth. It also is a reminder, that extra box, to always do the distractors. So in RR5, you have 5 trials with 5-second delays between prompting and distractors. How do you know when the patient is ready to master a skill? The first trial must be independent in RR5. It must be 80% independent over all the trials, with 2 people across 2 consecutive days. Again, this is more of a learning arts mastery criteria, and it will make a lot more sense when you're actually out in the field doing this. And the specialists and staff trainers will help you much more with this. There's what it might look like if you notice 80% over 2 days and 2 different people. Correction procedures, CP. If you've noticed, we talked about what if always when the person gets it right. What if they get it wrong? What if we ask the question in the discrete trial and they get it incorrect? This is when we would do a correction procedure. This is what you do when the individual performs the incorrect response. If the SD is do this, and the child does the behavior before the prompt, correct the missed attempt, repeat the SD, and prompt it immediately. That's one trial. Circle CP on the datasheet. So again, if the SD does not match the response, if we ask, say, touch head, and they touch their belly or something, before you're able to prompt the correct answer, correct the missed attempt. You would repeat the SD, prompt immediately, so you grab their hand, have them touch your head, or gesture to their head, whatever prompt level they're on, and you would circle CP on the datasheet. So just one more time. If the SD is, say, something like touch your head, and the child touches their stomach, before you're able to prompt them not to, or redirect them not to, correct the missed attempt. You repeat the SD, touch head, prompt immediately, have them touch their head, and then circle CP on the datasheet. That's how you would record a CP.